Hi, my name is Lacey Bloy. I'm a student registered nurse anesthetist. I'm going to be doing an assessment on your lungs, your heart, and your abdomen today. So I'm just going to start by giving my hands a quick wash. And while I'm doing that, I'm going to just visually inspect your breathing. I'm going to expose your chest here just a little bit. Watching for symmetrical expansion, no retractions, no audible wheezes. So that all looks good. Great. Just keep breathing regular. I'm going to have you go ahead and take off your cardigan, and I'm going to come back and visually inspect your back over here. And yep, just breathe normal for now. Again, inspection, no audible wheezes, symmetry. That's good. I'm going to place my hands on your back now and check for symmetrical expansion. So I'm sorry, my hands are cold. Just take a deep breath and let it out. Good. Deep breath and let it out, and you've got great symmetry there, so that's good. Now I'm going to have you kind of cross your arms and then raise them up to about 90 degrees. That's perfect. I'm going to percuss just some areas, just listening for dullness and resonance. Lateral areas as well right now. Good. Okay, I'm going to place my hands, keep your arms just like that. That's good. I'm going to place my hands on you again, and every time you feel my hands move, I want you to say toy boat.
Toy boat. Toy boat.
Good. Down here.
Toy boat.
Great. Okay, so now I'm going to just go ahead and listen. So every time you feel my stethoscope move, I want you to take another deep breath, and I want you to be taking breaths with an open mouth, in and out. Great. Check your lateral lungs now. Deep breath. One more time, I'm going to check one more lobe over here. There you go. That's great. Okay, you can set your arms down. I'm going to come around to the front now. Because I've got a few little palpations I've got to do in the front, and I need to assess for the sounds in the front too. So let's start by Good. Okay, and now I'm going to listen again over those lobes. Deep breath. Open mouth, please. Thank you. Good. Excellent. And deep breath. Great. Okay. I'm going to have you take 2 more deep breaths because I'm going to listen at the apices of your lungs up here. Great. Great. Now I'm going to listen to your carotids so you can breathe normal. Your carotids are right up here. Now I'm going to palpate those. Strong. I'm going to now just have you lean forward, and I'm going to assess specifically for your aortic valve function. So I'm going to have you take a deep breath, and I'm going to listen to your heart right here, and then once you let out your breath, just hold it out. Okay, good, great. So now I'm going to have you lay back onto your back, place your head on this backpack here for me. If you're in the hospital, I would, obviously raise your head to 30 degrees, but gotta work with what you got. So I'm gonna again visually inspect the precordium. I can see the point of maximal impulse, and I'm not seeing any strange fibrillations or heart fluttering, or your heart's not beating out of your chest. Everything looks good there. So now I'm going to palpate your contrachondral regions. It's just like the point where your ribs meet your sternum. So I'm gonna do that bilaterally in a couple different intercostal spaces. So that's good. And now I'm gonna palpate the major areas around your heart. So right over here, here. Move your clothes a little bit. I'm sorry. Good. Okay. Now I'm going to listen to your heart sounds in those areas. Heart rate is regular. Hear that loved up really well. Good. Okay, now I'm going to have you lay onto your left side. And with the bell on my stethoscope, I'm going to specifically assess your mitral region and your mitral valve. Good. You can lay back on your back. That concludes our cardiac portion. So now we've just got the abdomen left. And same thing again, assessing your abdomen, just visually inspecting it. Place your hands to your side, thanks. Just visually inspecting, and I don't see any lesions, petechiae, stomach is flat, anatomy is within limits. So I'm first gonna go ahead and listen just for your bowel sounds, make sure everything's working in there. Good. Bowel sounds are normal, active. Now I'm going to auscultate with the bell stethoscope just for some higher pitched sounds in your arteries, as well as your aorta here. So up here I can listen for your renal artery, your other renal artery. Move your clothes just a little bit to get down to the iliac artery. Good. And the aorta in your epigastric area. And I can even attempt to palpate that aorta. Feel it just fine. Okay, so now I'm gonna percuss specifically for your liver, so I'm gonna have to just move your clothes a little bit again, but I'm gonna just listen for that change in resonance. I'm gonna come down from the top now too. Good, so yeah, I can hear that dullness right in this area here. And now over here, I'm gonna percuss for your spleen. I'm gonna percuss a little bit differently. I'm gonna have you just breathe normal, and I'm just gonna continually tap. Okay, good, and you notice as you breathe, you don't hear any change in sound, so that gives me a good idea that your spleen isn't enlarged. So now I'm gonna go ahead and palpate all your quadrants and palpate your liver area and your spleen too. So I'm just kind of feeling around. And you let me know if you feel any tenderness or pain or cramping. You look pretty comfortable right now. Go ahead, take a deep breath. I'm kind of gonna feel just a little bit under there. Good. Liver seems good. All right, and same over here with the spleen. Deep breath and let it out and hold it out. Good, good. That looks good. All right, then the last thing I'm gonna assess is your kidneys. So I'm gonna do one more of those deep breaths, and you let it out and hold it out. And I'm gonna kind of give a little squeeze right on your side here. Okay. Right, deep breath. And let it out. Okay, good. Okay, and we're gonna do the same thing right over here. Deep breath, and let it out. Good, and hold it out. Okay. Well, everything seems to be in order. Thank you so much for your time.
Thank you.